Woo, this is a whole can of worms. So I can't even remember, 7, 8 years ago, the United States Preventative Services Task Force recommended against prostate cancer screening with PSA and digital rectal exam and gave it a grade D recommendation, meaning recommend against screening. Now that has gone back to a C. But interestingly, when this grade D was provided, the number of men who underwent screening decreased for several years, and studies actually showed an increase in the number of men presenting with metastatic prostate cancer, which had spread, and that is likely due to the decrease in screening. So screening provides benefit. I have no doubt. What is also true, though, is men are overtreated for prostate cancer. So how do we find a happy medium? One, unless a man has a life expectancy of 10 to 15 years, they should not be screened. So 85-year-old grandpa, unless both of his parents live to be 125, should not be screened for prostate cancer. It is absolutely that simple. Now, we need to take every patient on a case-by-case basis. But, for example, an African-American man who has an increased risk of prostate cancer mortality and has a family history, he should absolutely be screened. And in my opinion, most men aged 50 to 70, unless they have significant comorbidities, which would indicate they're not going to live 10 years or greater, should be screened. Now, screening does not mean that we necessarily commit to a biopsy. It doesn't mean we commit to a specific treatment, but it does mean we have awareness of what's going on and have awareness of the patient's risk of developing prostate cancer. So when I hit 45, 50, which is coming up relatively soon, I will consistently screen for prostate cancer. Now, if I get diagnosed with a very low-risk prostate cancer, you are not going to treat me because my risk of dying would be extraordinarily low. So once again, there's not a one-size-fits-all here, but when the United States Preventative Services Task Force tried to do a one-size-fits-all and recommended against for all men, they did a disservice to men, and I think in the long term will have caused some men to die from prostate cancer.